I'll go ahead and call the Peoria County Board to order this Thursday, March 12th, 2020. If everyone would please rise and join me in a moment of silence, followed by the Pledge of Allegiance. We have a young man with us tonight who I'm going to invite up. He's my favorite little guy, Jonah from the Uplands, who's promised me he knows the pledge. You'll meet his mom here in a minute. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Sure, we'll learn more about my friend Jonah in just a moment. Madam Clerk.
We'd be at roll call. Okay, is there four missing? 1, 2, 3. Should be only 3. 1. There we go. 15 present.
Thank you. The agenda calls for our next item to be proclamations and presentations. What happens in life when we make agenda is...
Sorry. Approval of the minutes first, sir.
Okay. Is we will need to adjust our schedule for the reason of some important news from our health director here tonight. So for those of you that are planning on getting out early, it's going to take a few more minutes, but you're going to enjoy being educated. Having said that, I'll take a motion to approve the minutes of February 13th, 2020. Thank you, Ms. Williams. Thank you, Ms. Rutherford. Any additions or corrections? Seeing none, please vote. Now I will invite Monica Hendrickson to join me. For those of you who don't know, Monica is the esteemed director of the Peoria City County Health Department, and she normally needs no introduction in this room, but for the benefit of some of y'all here the first time, I'll tell you who she is. Monica, welcome.
Thank you.
Thank you for everything you're doing.
So I want to take the opportunity to address the Peoria County Board in terms of our efforts as a community in response to COVID-19 or coronavirus 2019. Currently, last Wednesday, the Peoria County Emergency Management Agency and the Peoria City Office of Emergency Management opened a joint operations center to coordinate the response for our full community. This included making sure that we have a strong policy group to address ongoing issues that might come through the community, as well as public safety, fire, EMS, and the largest one being, of course, our healthcare and public health response. And in doing so, we wanted to coordinate information and public information specifically so that we're able to share messaging and guidance to our residents and actually in our larger region to make sure they're aware of the situation. And the term you often hear is fluid or evolving, and that's exactly what it is. It changes not only by the hour, but easily by the minute, depending on when information is being shared from the nation as well as from our local Illinois Department of Public Health. In doing so, we have coordinated a Joint Information Center, or JIC, the Central Illinois PIO group, which was really important during the Washington tornadoes. They're actually manning that and making sure that they are disseminating information from a regional approach as well as locally so that, again, consistent messaging is really key for our public. In terms of what the goal of our response is, we are not assuming, nor will we assume, that we are trying to stop all cases. We know that eventuality we will have cases here locally by just the trajectory and how this virus spreads. What our key goal that you'll hear more and more is that we are trying to slow it down. And the reason why is that in a situation like this, the true disaster is not necessarily the individual health issue, but that in combination, what that means to our most valuable resource, and that is our healthcare system. They have a limited number of staffing, beds, procedures, and so forth. And while this is still going on, remember, we still are having overdoses in our community. We're still having heart attacks, strokes, babies are being born. All that is still business as usual. And so to have this layer on top, our goal is to make sure that the cases don't spike in such a short amount of time that it stretches our healthcare community to a point where they're not able to respond or triage properly. And that's what we're seeing in some of our other countries. With that in mind, our goal is to use various mechanisms to really, the term is flatten the peak, so to speak, to keep it under that threshold, if you can imagine kind of a bell curve. And the idea of keeping it under that and the type of policies that we're looking at are things that you're going to start seeing more and more in the community. You're going to see a cancellation of events, decreased gatherings. We're going to see restrictions for visitors at our healthcare communities as well as in our nursing homes. And we're also going to see possible school closures. All of these are meant to slow down those number of cases so that the healthcare system can manage it and not become the next emergency that we're seeing in our community. So with that, this is a multi-sector response. Not only public health and healthcare, but our school districts, our law enforcement, EMS, and our social services agencies are all playing a role in this and wanting to make sure that we are able to provide our community the support so that we are in this for a long time. It's a marathon. And with that in mind, we want to make sure that we are protecting the health of our community as much as we can. I'll open up to questions.
Thank you, Monica. I've been in much longer meetings and multiple times and not heard you that succinct before, so thank you. There is a tremendous effort underway using our incident command models, and most everybody's had some background in them that are involved, and it's quite the effort. I think this is a time when our public probably gets to see a much more visible public health event effort undertaken by her team. This is a massive operation when you count all of the individuals and organizations involved. There are easily thousands of people being coordinated through this little center hub over here at the microphone. It's extraordinary. So just taking the employees of the two hospitals, all the public safety services full-time and volunteer in Peoria County, and on and on and on and on. It's an extraordinary effort. So, General, welcome. Thank you for everything you're doing. And if members have any questions, I'd be happy to open the floor now for them. And then Monica is always accessible, but happy to give you the guys the floor. Seeing Ms. Williams and Mr. Fell.
So the questions I keep seeing is, what should someone do if they suspect they have it, and are there tests available?
So in terms of the first question, if you're concerned that you have it, you want to reach out to your healthcare provider, and you want to reach out to them from telephone first. You want to get assessed, and partly because, again, we want to control how many people are accessing their healthcare system. Majority of individuals who contract this will be able to stay at home, use fever-reducing medication, plenty of rest, plenty of fluids, and kind of manage it at home. And so that's really what is going to be pushed out in terms of our triaging aspects. Having said that, we want to make sure that we leave the testing to those high-priority groups, those that have traveled, as well as those that have had contact with known cases, and individuals that are high risk, because the high risk individuals, as we've seen from the data, their disease progression is really severe. And so by catching it early, they can, the healthcare community can actually assist in trying to control it before it gets to a point where it leads to that mortality that we're trying to avoid. So there is testing available, but it is being prioritized. All the healthcare systems are able to collect the specimens for testing. They coordinate with the local health departments to get a ID number and is sent to one of the 3 state labs for further testing. And we're really focusing on priority testing through the state labs. Now, there are some private entities that have started testing, and healthcare providers can send their specimens to those entities for testing, but those are usually for low priority aspects. And so the interesting thing to note, there is no vaccine, there is no medication. And so a lot of times being able to triage with your healthcare provider is going to be the best, because then you're going to be able to control, isolate, self-isolate at home, and monitor your symptoms. And if it does progress and worsens, then yes, we'd want you to go see your healthcare provider, but primarily you're going to want to stay at home. So again, the big push is to contact your healthcare provider and work with them to understand your risks.
By way of reference, and I know we can't get it on the scroll because we didn't think about it in time, but the City County Health Department website, as well as the Illinois Department of Public Health and the Centers for Disease Control, all have absolute up-to-date information, and the Health Department's website can bump anybody to those through hot links. There's also real-time toll-free hotline in Springfield that the State Department of Public Health put up. That number is also on our county health department's website. So Scott can push some more of that data out. It's already there. I would do the WW thing, but it's on our website. Mr. Fennell.
Thank you. Monica, wish you could kind of communicate a little bit about some of the other agencies that we had a little discussion earlier that are involved, that you're coordinating through to try to help some other people. It's not just Peoria County and City, it's all these other Red Cross and all these others. If you could just touch on them a minute.
And so as this marathon of response continues, we're going to be relying a lot on our community partners that do that supportive services, whether it is food or housing, as well as even social interactions, childcare, all of that, because, as this progresses, we might have employers that are still having work or don't have work from home options, but their schools are closed. And so what we're trying to do in this preparedness phase, which is what the phase we're in right now, is to align those resources so that as this progresses, we can activate them to start working with various communities and different populations to address those needs. Examples would be a meal program that delivers to seniors so that, again, a high-risk population is not necessarily going out and putting themselves in further exposure or risk. And I do want to add that to help with the communication, the PIO group, as part of the joint information, has decided to do a stand-up briefing every day, Monday through Fridays at 4 p.m. And we'll have myself and our medical director, Dr. Greg Stoner, as well as other community partners and healthcare members to answer questions for the media. Again, this is a really evolving situation, and so we're wanting you to have that kind of stand-up meeting to address the questions as they come in a really succinct fashion so that the public can get to that.
Thank you. Anyone else? Mr. Elsesser.
Well, I'm certainly hopeful that we don't have anyone in Peoria County that comes down with this, but maybe that's an unrealistic assumption or hope. But for right now, I'm assuming as long as we don't have anyone, that the decision to remain open as far as a school or a large church or something like that is up to that individual entity. Is that right?
So, our superintendent, Beth Kreider, can speak more so on how school closures are operating, but it's still based on the local entities. We are in a preparedness phase. However, we are focusing on flattening that curve, and one of the things that we are looking at is making sure that we do restrictions in large gatherings. So, for example, churches or temple or whatnot, working with religious institutions to understand how they do social distancing or different aspects to kind of control transmission in those spaces. And so we're still in the preparedness phase, but it is very fluid, and moving towards that, we want to just take the steps now to kind of draw this out, oddly enough, as long as we can.
That answer your question, sir? Again, that information is evolving hour by hour in the county health department's website. has absolutely the most up-to-date information as it's in, and it's changing all the time. Larry, did you have a question? Okay. Anyone else? Ms. Pastusha?
I don't have a question, but I just want to say thank you and how I have great comfort knowing that you are in charge and with your epidemiology background. I think Peoria County will be in good shape with you leading the way, so thank you for all your hard work.
Thank you, and I appreciate all the community partners from the county and my staff. They just do great work every single day.
As I'm sitting here, I just received an email from a chairman somewhere in Illinois, I won't name, asking for assistance from our health department because they've decided they're woefully behind. So, in working with her for the last 2 weeks, I can tell you Peoria County is way out in front, and that's because of Monica. So, thank you, Kate. I'll send you the email, Monica. Anyone else? Anybody from the public have a question? It's rare for me to do. While you're here, no sense not looking for you. Okay. All right. Thank you very much.
Ready to move on? Proclamations and presentations. First is a proclamation recognizing Center State International Trucks Incorporated on their 40th anniversary.
I know we've got a big group here, and I'd like Jonah to come up for sure. Jonah, aren't you coming? I hope the entire family and all the team members from Center States are coming up. I will. If you're teammates from Center States or friends of the family, or if you owe a little bit on some equipment, you're welcome up. This is like a really extraordinary moment for me because I know Kelly. And she'll tell you it took me about 5 years to remember her son is not Noah, but Jonah. I got it in my head the wrong way. So welcome, Mr. Elsasser.
Well, this is quite a privilege for me because you know how I feel about small business people and kind of related to the farming community as well because this is a great family because I told them we have a Freightliner semi tractor and they were actually fine with that. They said they still wanted to come up. So, but I did see on Facebook. I guess there is something that good that can come from Facebook from time to time that they had celebrated their anniversary, and initially I thought it was their 50th anniversary, so I sent a message to Kelly and I said, we'd like to recognize you on your 50th anniversary, and she said, oh no, it's only our 40th, and I said, that's fine, that's a long time, and we appreciate and are so thankful that you're in the Peoria area and all you do for bringing jobs here and great service to the farming and distribution and anyone who needs a truck. And with us tonight, I'll introduce four of the people. Gary and Beverly Prepashal, and then Kelly and Jonah Perkins, and then I'll let Gary introduce all the rest of the family and friends and employees after we read the proclamation. Whereas Peoria County congratulates Center State International Trucks Incorporated on its 40th anniversary, and whereas Gary Prepachal started Center State International Trucks in 1979 and operates it to this day, and whereas Gary Pripashal was awarded the Peoria Market from International Harvester Company in 1979, and whereas Gary Pripashal chose to relocate from Chicago to Peoria as he believed the city would be a positive community to raise a family, and whereas Center State International Trucks has expanded to encompass locations in Peoria, Illinois, West Burlington, Iowa, and Jacksonville, Illinois, and employs a total of 90 individuals. And whereas Center State International Trucks is a full-service dealership specializing in giving customers custom transportation solutions for those with small and large fleets. And whereas Gary Prepashal's daughter, Kelly, has been with the company for 20 years and has been chosen as his named successor. And whereas Center State International Trucks proudly supports numerous charities such as Goodwill Industries of Central Illinois, Boys and Girls Club, the Yellow Bear Foundation, and Peoria Promise. Now, therefore, I, Andrew A. Rand, Chairman of the Peoria County Board, on behalf of the County Board, do hereby recognize Center State International Trucks on their 40th anniversary, dated this 12th day of March 2020. Andrew Rand, Chairman, and Rachel Parker, Peoria County Clerk. And I'm going to have Andrew make the presentation because I know he knows the family even better than I do.
Thank you, Andrew. Thank you.
Thank you.
Thank you.
Well, I just want to thank the board. I tell you, they've been very supportive for small business in this town for a long, long time. I know that they provided us some assistance and help in some difficult issues way back here, a couple, 3 years. But again, you know, Peoria's been a great place to raise our family. My wife's kind of, you know, been there for the whole thing, for the ride, and so has Kelly, pretty much half of her life. And I've got a lot of great employees. A few of them are here tonight. I got a great grandson sitting here, or standing here. So, and I'm just going to introduce a few. That's Sam Craig. He's my controller. And his son, Sam, who now works in our Iowa store. And Jake Van Cleve, who's out of Jacksonville. And I've got a couple of Navistar guys that came down to kind of support us on this, Craig Medvick and David Brown. And, you know, without all of these guys, we wouldn't be here. So, and really thanks again to the board. I appreciate it. Thank you.
Thank you.
Thank.
Thank you very much.
Did you get a picture with Andrew in it, or I think?
Okay,
Okay.
great.
Okay.
Thank you.
Okay. And thanks so much. We're so glad you're in Peoria.
Thanks, John, for taking the picture. Another a good customer and a great supporter of the board too. So.
Next would be a proclamation recognizing April and May 2020 as Gerald M. Brookhart Arts in Education Spring Celebration Months.
Thank you. I invite Member Daly to join us up front here to make the proclamation. Joining Ms. Daly is the superintendent. Welcome.
Whereas the Peoria County Regional Office of Education is committed to the establishment and continuation of programs in the schools which provide the opportunity for academic excellence in students, and whereas the Peoria County Regional Office of Education supports the development and promotion of programs in the fine arts and applied arts. And whereas the Gerald M. Brookhart Arts in Education Spring Celebration is a harbinger of spring and now includes over 100 schools from 7 central Illinois counties: Peoria, Tazewell, Woodford, Fulton, Marshall, Henry, and McLean. And whereas this year's Gerald M. Brookhart Arts in Education Spring Celebration is the 35th annual event of celebrating the arts in Central Illinois, and whereas the 2020 Gerald M. Brookhart Arts in Education Spring Celebration will take place from Wednesday, April 15th through through Friday, May 15th, 2020 at the Peoria County Courthouse Plaza. Now, therefore, I, Andrew A. Rand, Chairman of the Peoria County Board, on behalf of the County Board, do hereby proclaim the months of April and May 2020 as Gerald M. Brookhart 2020 Arts in Education Spring Celebration Months, dated this 12th day of March 2020. Signed, Andrew Rand, Peoria County Board Chairman, and Rachel Parker, Peoria County Clerk. So very much. You want to say something? Yes.
Do you understand why in the office we call it the GMB? I love hearing his name, and I love this event. It's one of my favorite things about the office. And on a rough day like today, to remember what it's really all about, and that is the children coming down and celebrating their talents. It's not until April 15th, so we will hold off any kind of declaration about whether or not we're going to host the GMB. We're going to keep everything moving forward. Like, we're going to be able to hear those beautiful voices and see that lovely art starting in April. We're going to kick off with Jazz Day down at the Riverfront Museum because they are such excellent partners. And you can come hear some great jazz down at the museum, and then the rest of them will be out here. So hope to see you there. Thank you, Chairman.
Thank you, Beth. Congratulations, Beth. And thank you for keeping Jerry's flame burning.
Next is a presentation by Refreshing Ministries.
Thank you. Welcome. I think maybe we could ask Brian to give a little introduction here, and I'll get you a microphone.
Okay, thank you, Mr. Chairman. Tonight we have with us Mark Doris and his wife Cheryl, who's back here, and they are constituents of mine. But they did a lot of renovation in their basement several years ago, in order to really do this one-of-a-kind effort that I think we have in this whole Tri-County area. I don't know of anyone else that would take on this kind of a venture other than Mark and Cheryl, and so it was arduous, and they had to get through all the regulations and different things, and we made it, and everybody worked together, and now they have a fine finished product in their basement and a great place for people's lives to be healed, and we're so thankful that you, Mark, and Cheryl have come tonight to give us a PowerPoint presentation on what you guys are doing.
Well, thank you for the opportunity to share with you what is Refreshing Mercies actually is, and that we're excited that we're a part of Peoria County that is doing good things, for our state, and not just our state, but our country, and even impacting around the world. So what we'd like to share with you is just how our, what am I not doing properly here? There we go. Okay, thank you. Lamentations 3 says this. Okay, the faithful love of the Lord never ends. His mercies never cease. And I think our timing did not get eliminated here, Scott. So I'll just talk real fast. It's in Lamentations. Okay. Boy, I think it's even advancing farther than... Hit the escape button. Okay. He actually had this all ready to go, so it's not his fault.
It happens all the time. It's okay. You're
all
good.
set? Okay. All right. Thank you so much. The faithful love of the Lord never ends. His mercies never cease. Great is his faithfulness. His mercies begin afresh. So refreshing mercies. All right, each morning I say to myself, the Lord is my inheritance, therefore I will hope in him. And we want people to experience hope. What we do is we help people of all ages, help them through the losses of life, the transitions of life, and the tragedies of life. Not just adults, but all ages, because all ages are impacted by those three things. Okay. Our focus is grief associated with loss through death, losses through transitions of life. That death is not the only loss that takes place. Challenges of ministry, disillusionment, burnout, hurt, and then losses in life that can be jobs or divorce. Boy, losses just can take any type of title. And then we're also available to speak. But right now, we are providing things for hurting people by providing an intimate retreat setting at our home. It's a walkout basement, and in Dunlap, there's a lot of beautiful country there, and we're able to be a part of that. And so we try and really utilize that, but it's a kind of a retreat setting, a walkout basement. Scheduling people to come in on or close to the date that is significant to them. If you have gone through a significant loss, you know that a birth date or the day of a death, the date of a death that comes around can be quite significant, and grief can be complicated. And sometimes you just need to get away from the world and process the journey that you're at. And we try and help people do that in their particular loss. So we try and schedule close to the date that they want to come. Hosting one family or one team at a time. We can hold up to 8 people. We don't want it more than that, but we want people that are coming, that are a part of a family. They're coming for a particular reason, centered around that particular loss or trauma that they're experiencing. Guiding them through their journey for a closer relationship with God. We want to give people hope. And then providing an interactive program that's designed for their specific needs. We're constantly, even when they're with us for those 3 days, 2 nights, we are constantly adapting the program as we hear their needs. We have booklets that we've put together that help them process for children all the way through adults. And then the last session that we have with them, we have, if it's a loss, we have been listening to them. Listening to and asking questions about their loved one and hearing those memories. And then by the time they leave that last morning, we give them a little booklet with those memories intertwined with a little bit of scripture that they can see just hope, and they can be reminded of their loved one's life and finding hope. In fact, we gave one to a widow who had lost her husband. She has grandchildren, and we read her that book and handed it to her in tears. She turned to us and said, I now have something to give to my grandchildren to help them remember who Grandpa was. Very, very meaningful for us to be a part of something like that. We are in Dunlap, Illinois. Beautiful setting there in Dunlap. This is our gathering room where we do a lot of our sessions and interacting with them. Another angle of that, creative expression room is one of these treasured things that people go through. We have, my wife is very creative, and she has put together a variety of activities for people to work on with their hands. In a digital world, we think working with our hands are very helpful in processing our grief. And so through a lot of options of working with your hands to remember the person who you have lost, they then leave with at least 2 or 3 items that they will go home with that help them remember their journey and where they're at, and even with their loved one, about their loved one. You'll see here in our chapel there's musical instruments. People enjoy music. Sometimes they want to express themselves. We have a keyboard there if you're proficient, guitar. We also have hand drums and percussion instruments, because anybody can bang a drum or rattle a rattle to just kind of express yourself. And so we have a variety of those things, and people really seem to enjoy that, to express themselves through music. One of our double suites that can also be made into a king-size bed there. This is the family suite. We've wanted to have a larger room where when children come with mom and dad, they're able to sleep with mom and dad during those nights. A kitchenette where they're able to have some meals there. And then we really believe that nature is a great healing tool. And so we provide a lot of activities outdoors that we've created there. And then the time around the fire, we offer that to folks. Their first night there, it's interesting. People coming from different parts of the state or country, from cities, and they haven't had a campfire since they were a little kid. They come, experience that the first night, and then say, can we do that again? And so on the following night, they're out there enjoying that again. Just a very comforting time. Well, Refreshing Mercies, discover, heal, and grow is what we're trying to offer. Not just folks in Peoria County, but we are seeing folks from the Midwest come to Peoria County. We're actually even helping folks from different countries in Peoria County. And so I think it's just an honor to be able to represent Peoria County with something like this. Thank you for the opportunity to share.
Thank you, sir. Thank you very much, Mr. Elsasser.
Mark, you might mention, that, because I know you did to me, that you also help families, military families, where there has been a long deployment. when the person, he or she returns home to the family, and sometimes there's a lot of challenges there too. So.
Yes, we do have opportunity to help folks who are in the military and have experienced loss, the traumatic loss of their loved one overseas, and not even be able to experience having the body brought home because of the particular way of that person's passing. And so there's a lot of complicated grief that goes with that, and it has been an honor to serve our military. And all of our first responders. I think there's a special place in our hearts because of family history with firefighters, police in our family, and military. Those first responders really have a special place in the hearts of us at Refreshing Mercies.
Thank you again, Mark. Welcome. Pleased to have you. Rachel?
Next would be a presentation by Trajectory Energy.
Welcome back. Nice to see you again. I think Mr. Sorrell will cover you with a microphone.
Thank you, Mr. Chairman, and the rest of the board. The last time I was here was fall of 2018, and we wanted to give everyone an update on some solar projects that we've been working on where the land is owned by Peoria County. I'm John Carson, the managing partner of Trajectory Energy. I want to introduce Dan.
Hi, I'm Dan Newcomb, also from Trajectory, and I'm a resident of Pekin.
All right, so in 2016, the Future Energy Jobs Act was passed, which supported all different kinds of solar across the state, and I believe in 2018 you saw over 30 zoning cases come through for community solar projects. 7 of those projects were our company's projects. We worked with landowners, we got them zoned, and in spring of 2019 there was a lottery to determine which of those projects received state funding. Unfortunately, none of our 7 projects in Peoria County were in the top tier that were picked. One of them is quite high up on the wait list. It's only number 3 on the wait list. But in particular, we wanted to give you an update on the 2 projects that we have a lease with Peoria County itself. Because while there was a lot of activity on what I'll call regular community solar and also what are called behind-the-meter systems projects for schools, in that whole category, there was 0 discretion if the project was for an international corporation or a local school district. That had no impact on whether or not they were picked. But there is another program that was part of the same state law called Illinois Solar for All. And we are planning to see if we can build the projects that we have with Peoria County through the Illinois Solar for All program. The main point of the program is that it supports solar projects where the benefits go to families with low and moderate incomes or nonprofits or public sector entities that are supporting and working with those communities. You have to be a pre-approved vendor, which we are. The benefits are targeted to certain geographic areas, lower income areas, areas that have experienced environmental justice issues, a legacy of pollution in those areas. And importantly, with this program, there's very specific targeted savings, guaranteed savings for the residents and participants. This program does support residential systems, it supports behind-the-meter systems for nonprofits, and also supports community solar. One of our projects that did win in 2019 is Rockford Solar. This is an example of an Illinois Solar for All community solar project. The land is owned by the city of Rockford. It's an old abandoned rock quarry that was filled in. It's definitely an environmental justice area. For this project, the Rockford Housing Authority will be the anchor subscriber to the project and save about $8,000 a year on utility bills, and will share about $100,000 worth of utility bill savings a year with Rockford Housing Authority residents. And this is a program that we intend to try to be able to enter our Peoria projects that we have with the county into. These are the 2 projects that we have a lease for, and we have a zoning permit for from the county. They're out by the county jail site, and they do meet those attributes. First, they are, of course, owned by a public sector entity. And there's a process that you can go through to determine if the area for those sites is an environmental justice area. We are actually working with Central Illinois Healthy Communities Alliance on that process, gathering the data of, the unfortunate history of pollution and persistent poverty and other issues in that 61604 area code. We'll be going through that process this spring, and then this June and July is when we'll turn in the application. We'll find out in August or early September if Peoria 1 or Peoria 2 are selected for that program. Meanwhile, this year our Rockford project is getting built. There'll be 7,000 solar panels on that old quarry by the end of the summer. And we are also actually we also have another project in Ameren territory that is getting built this year as well, which is part of Illinois Solar for All. That one, the landowner is the city of Urbana. This program is targeted towards low and moderate income families, so there is an income qualification. You can see the numbers up here. For a family of 4 in Peoria County, that's $58,000. For an individual, $40,000. So anyone below those income levels can participate. And the savings for this program are significantly higher than what I'll call regular solar projects or regular community solar. Just to briefly show you how that works, this is what your Ameren bill might look like now. You pay supply, delivery, taxes, and fees. If you did a solar system behind the meter on your own roof, you would of course save on both supply and delivery because you're producing your own energy right there. The way community solar works is as a subscriber, and even though our projects are for this year are over in Urbana, anyone in Ameren territory can subscribe, and they get a credit on their Ameren bill for the electricity that project's producing, and then they pay a second bill for that subscription, but at a 50% reduction. So in this example, the family's bill was originally $90. They see a 40 credit on their Ameren bill. They pay $20 for that $40 credit. Their new total is $70. So again, we are going to be working this year in 2020 across Ameren territory, particularly Champaign-Urbana, Bloomington, and here in the Peoria area, we're going to partner with METEC, a wonderful service organization that already works with these targeted families, and we'll be signing people up for our Urbana project here in Peoria this year, and hopefully if we are successful in getting to build our Peoria project that you're the landowner on, we'll be subscribing up families for that in 2021. Okay?
Let me ask you some hard questions.
Absolutely.
Oh, no, not at all.
Oh.
Anybody have any questions for these fellows? It's an update. A lot of variances went through last year, and Scott was reminding me why Mr. Dillon asked for the privilege of the floor for these folks from Trajectory. We're happy to give it to them. Any questions? Okay. Man, thank you, Junior. Brian?
One of our citizens asked if you could explain what environmental justice is.
And environmental justice is a term that does mean different things in different states, different places, but it typically means communities that have persistently seen a lot of pollution over the years. Oftentimes, coal plants have been located in lower income communities, coal ash piles, other sites. Our Rockford project is a really good example. After this was a mine for 80 years, it was an open pit municipal dump for 20 years. And a whole series of heavily polluting industries came around it. Those areas tend to be low income, and those communities face those challenges.
Thank you very much, gentlemen. See you soon. And once again, I don't know if I mentioned it, Mr. Dillon asked for us to get these fellas in here tonight.
Next, we're at citizens' remarks, and I did not get any cards turned in.
No cards tonight. Madam Clerk.
Consent agenda?
Could I get a motion to approve the consent agenda, please? Thank you, Ms. Bastucia, and a second, Dr. Eden Blair. Starting on my left, your right. Any items to be pulled? Any items? You sure, Brian? Can we gonna pull something? There's got to be something. All right. If there are no objections then to the items listed on there, please vote. Thank you, Brian.
Okay, that'd be 15 ayes, 0 nays.
Before we move on, the sheriff who is getting a new dog here tonight has given the county board the opportunity to name the dog. So whatever your names are, submit it to him, and he'll decide which wins. Get to name the new canine. Sheriff has offered that up, so he just wants you to send your suggestions to him.
Zoning ordinances and resolutions. First is case number 002-20-V, petition of Insight RE Inc. as an agent for Lease Lynn Towers 3 LLC, a variance request from section 20-7.1.1.2 of the Unified Development Ordinance, which requires that the height of the telecommunication facility shall not exceed 200 feet if located in a non-residential zoning district. The petition proposes to construct a telecommunications tower at a height of 255 feet in the A2 agricultural zoning district, resulting in a variance request of 55 feet. The parcel is located in Hullock Township. The Zoning Board of Appeals recommends approval. The Land Use Committee concurs.
Thank you. Can I get a motion to approve? Mr. Alsasser. Second, Ms. Pastucha, thank you. Any discussion? Seeing none, please vote. I think naming the dog's getting quite a few giggles from the cops in the room. They usually come with a name like Drago or Darth, something German from their trainers.
That's 15 ayes.
Yeah, that's a pit bull. That'd be a pit bull, though.
Next is case number 2. Case number 008-20-U, petition of the estate of Donita M. Weary, deceased, and the estate of Glenn A. Weary, senior, deceased. A special use request from section 20-6.2.1.1.b of the Unified Development Ordinance. This section allows for a special use with the proposed land split does not meet the 40-acre minimum lot size in the A1 Agricultural Preservation Zoning District. The petitioner proposes to divide the existing 11.44-acre parcel into 2 parcels of 5.28 acres and 6.16 acres to separate the resident from the agricultural use. The parcel is located in Trevoli Township. The Zoning Board of Appeals recommends approval. The Land Use Committee concurs.
Thank you, Mr. Rosenbaum on the first, Williams on the second. Any questions? Seeing none, please vote.
There we go. Okay, that's 15 ayes.
Thank you.
Item 3, case number W03-20, Paige Ziegler, a resolution from your Land Use Committee recommending approval of a waiver of compliance from section 20-8.3.4.1b-2 or .2.a of the Unified Development Ordinance. This section requires a new minor subdivision to have public water supply. The petitioner is proposing to serve a 1-lot subdivision with private well. The parcel is located in Hullock Township.
Thank you. Motion approved by Mr. Elsasser and a second by Ms. Pastucha. Discussion? Seeing none, please vote.
Brian. Mr. Alsasser. And Mr. Rand. 15 ayes.
Thank you.
Next is a resolution from your Infrastructure Committee recommending approval of a cooperative research agreement between the County of Peoria and Bradley University for the purpose of maintaining the pavement management program.
Thank you, Junior, and thank you, Mr. Rosenbaum. Dr. Blair, do you know how you'll be handling this issue?
I'll be abstaining
Thank
because my employer is involved.
Thank you. Make sure I got that right. Okay, item on the floor. All those please vote.
That's, should we get them all in there? Okay, 14 ayes and 1 abstention.
And we will note the purpose being for your abstention that that's your employer. Thank you.
Item 5 is a resolution from your Executive Committee recommending approval of County Administrator's compensation.
Mr. Rosenbaum and Mr. Renault. Mr. Renault. Hello, Rob. Okay, so this item was passed out of committee earlier. For those of you that weren't here, it's the blue document. I want to thank once again the team that worked hard on this, which would be Mr. Ricker and next year's lead, Ms. Pastusha. Thank you. Also like to thank all of you who participated in providing feedback through the system of feedback, the survey tool. I'd like to thank Mr. Sorrell for reminding us to get it done on time. I think it's obvious what we're doing here. I don't need to read it into the record. So, any questions? Seeing none, please vote. Thank you.
15 ayes. Next would be executive session.
Yes. So before we do that, before we take 6, are there any comments under miscellaneous or announcements? Because after we go to executive session, we will come back out here and adjourn to go home. Mr. Renaud, welcome.
Thank you, sir. I just want to remind everybody about the census is coming up April 1st. They just sent out their first mailing. Some people may have already got it. It includes your census ID number that you need to go online to identify your property. If for some reason you lose the ID or you don't have it, you don't get it, you don't have to have the ID. You can still fill the census out online. They'll send out 4 mailings at first, just to remind you to go online to fill out the census. If you haven't completed the census in that amount of time, you will get a paper copy that you can fill out. If you don't know if maybe somebody else from your household has filled out the census, go ahead and fill it out. Their system will identify duplicates in September and fix all of that for you. So the important thing is to fill it out. If you don't, the other thing is if you have a P.O. box, you will not be receiving any mailing from the census because it is based on households and P.O. boxes don't necessarily represent a house. So if you do, it doesn't prevent you from filling it out early. Eventually they will knock on your door if you have a P.O. box, but you can go online, enter your address, and fill out the census. It is extremely important to be counted. For every person who's not counted, it costs our community about $20,000 over the 10 years. So if it's a household of 5 people, that's $100,000 that it costs our community over that amount of time. Not only financially, but representation in the House. The way they draw the districts is all, dependent on the census. The way the way the federal government responds to epidemics or pandemics also depends on the census. So it's extremely important for everybody to be counted.
Thank you, and thank you for your leadership on that effort. Others? Really? That's great. Please note that the best way to not get sick with anything flu-like or the bad kind of flu is, let's test Linda. Will you give me one way not to get sick? Hand washing, vigorous hand washing, 20 seconds, soap and water. Happy birthday twice. Any water will do, but warm water is better. How about you, Dr. Blair?
Social distancing.
Social distancing. So that's like this new term that's come up, which kind of means what? It's like how far Brian is sitting, you know, away over there. 6 feet or more. Anyone else? There's like 5 key ways. 6 at least. Mr. Elsasser.
If you don't feel well, you should stay home.
Absolutely. Number
e-
one.
Even if you don't think you have it.
Number one. I wish we were playing that, and the survey says. Number one answer. Who else? Mr. Fennel. Avoid handshaking. Absolutely. With that, don't touch your eyes, face, or mouth. It's really hard to do. There's one more out there. One more big one out there. Cough. What are you going to do about your cough or sneeze? Cover it. That whole elbow thing wigs me out, but it's good. And then obviously wash your hands vigorously afterwards. Those are the 5 major ways to avoid the spread of disease. And in particular, this not so good flu, because it's the droplet kind. It's the kind that coughing and sneezing is exactly what spreads it. So anything else? Seeing none, we will call for a motion to go into executive session.
Or pending litigation.
Purpose being pending litigation. Mr. Elsasser, Mr. Rosenbaum, all those in favor, please vote. Please vote, actually. Sorry.
Sorry, that was Elsasser and Rosenbaum. And vote.
And after we conclude executive session, ladies and gentlemen, I will come back out with the rest of the board and we will adjourn the regular session. There's no business after the session we're going into.
Everyone hasn't voted yet. Brian?
Brian, can I get a vote out of you?
And yourself, sir. And Paul?
Paul, Mr. Rosenbaum, have you got your vote
vote?
in? Yeah, he's got an eye down
Okay, there it goes.
We got it. We got it, Brian.
15 ayes. So I'm not going to end the meeting then, am I not? Am I going to leave that since we got to come back out?
Probably because there's a timing thing.
Yeah. So should I not end this?
She wouldn't log us out.